Good evening to all. Today we are going to discuss the new topic that is concept of evidence-based practice. Roots of evidence-based nursing can be traced to Florence Nightingale's era of nursing practices. The concept of promoting health, prevention of diseases, and care of sick were central ideas of Florence Nightingale by the evidence-based practices. Um, and it involves identifying solid research findings and implementing them in nursing practices in order to increase quality of patient care. Defi- Definition of evidence-based practice as using it is the best evidence to guide clinical decision making. Steps of evidence-based practices is to formulating a clear question based on clinical problem, literature review to search best available evidence, analysis of strengths and weaknesses of evidences, use of best evidences in clinical practices, evaluating the efficacy of empirical evidences, like formulating a clear questions based on clinical problem. The first step is to formulate a clear question based on clinical problems. The source for formulating question generally categorized into two broader classes, that is problem based source and knowledge based source. To frame a problem statement should include this Picot format. This Picot format, like P indicates population, I indicates intervention, C indicates comparison, and O indicates outcome. Here the time, T indicates the time. And the next step is like literature review or to search for best available evidence. This is the second step of evidence based practice process where essential and relevant literature related to topic is extensively reviewed. This time is another factor which is very crucial for information retrieval, and current and fresh information or evidences are considered more vital than older one. Evaluating and analyzing the strengths and weaknesses of evidence in terms of validity and generalizability. Use of rating system to determine the quality of research crucial for development of evidence-based practice. Implementing useful findings in clinical patients based on valid evidence. Evidence is used alongside clinical expertise and patients' perspectives to plan a care. Once a study plan is analyzed for strengths, weakness, internal and external validity, a decision is made about appropriateness of evidence for particular question initiated for evidence-based practices. Evaluating efficacy and performance of evidences through a process of self-reflection, audit, or peer assessment. Finally, after implementation of useful findings for clinical practices, efficacy of peer performance is evaluated through processes of self-reflection, internal or external audit, peer assessment. Purposes of evidence based practice. The purpose of evidence based practice is to evaluate evidences along a continuum to identify the strongest or best evidence to guide nursing practice within an organizational settings and with the specific patient population. Evidence based practice interventions are stricter and more perspective. Goal to eliminate unsound or excessively risky practices in favor of those that have better outcomes. The ultimate goal of evidence based practice in nursing is to provide the highest quality and most cost efficient nursing care as possible. Barriers of evidence based practices, like overwhelming amount of information available in the literature and further create confusion among the practitioners, like taking too many kinds of reviews or literatures, and it will be like burden to us and again confusion. So take a limited, like the information which is helpful us, and not take too much that can confuse us. Okay, lack of professional ability to critically appraise a research, lack of time, workload, pressure, competing priorities of patient care, lack of knowledge, lack of support from colleagues, organization, and lack of confidence and authority, lack of administrative supports and incentives, lack of continuous education programs for nurses in India, ethics in research, ethics in nursing research. The word ethics in Greek word they used to say ethos. It is the root of term ethics means customs or characteristics. There are four basic ethical principles which we will follow, that is autonomy, respect or respecting rights of others, beneficence like benefit doing good or benefit. Non-maleficence means not harming anyone's, and justice like being true and being truthful, like equality, rights, justice. Definition of ethics here: act of moral principles that researcher has to follow while conducting nursing research to ensure rights and welfare of individual or groups. Principles of beneficence: establishing a positive risk benefit ratio where risk of should never exceed expected benefit generated by activity. Principle of justice: this ethical principle directs researchers to abide by participants' rights of fair treatment and maintenance of privacy. Principles of respect of human dignity and fidelity: this principle of ethics emphasizes freedom of choice, where participants have right to accept or decline being a part of research study, and informed consent must be obtained, preferably written one. Informed consent document. Nursing research involving human participants, the investigator must obtain informed consent for the prospective participants. Ethical responsibilities of a nurse research: ensure the respect of individuals' autonomy is consenting to participate in research, an adequate protection of valuable group in the study, such as children, elders, pregnant women, mentally ill patients, physically disabled, terminally ill, and institutionalizations. The nurse researcher must ensure the optimum balance between risk benefit ratios through ensuring minimizing potential harms and maximizing the possible benefits. The privacy, confidentiality, and anonymity must be promised and protected during the entire study period. Maintain a competency in identified research area and potency in research methods. Overview of research process. Research process is a systematic step-by-step method used by a researcher to find answers to questions or solve problems using scientific methods. So here some steps of research process is like identifying research problem area. Identifying exact research problem, what is the problem where we are going to doing our research, like, and formulating broad study objectives for that. Review of literature, what problem statement we have to review that, or else we have to we need to check that how many studies were conducted, what kind of outcome where they have received is like that we have to review. Entry in the research setting, like selecting research approaches and designs for our research problem, what kind of design will be helpful, and selecting a small sample population and types of selection of samples, establishing ethical considerations, planning of tools for data collections, sample design and collecting of data, organizing data for analysis, like testing hypothesis, analysis and interpretation of data. Finally, disseminating the research findings or preparation of research reports and publication of our research reports. Like here, we'll end up our first unit of introduction to research. Thank you.